Well, there's a lot of problems that people don't realize are associated with the sinuses. The sinuses are at the core of your breathing function. They're at the core of, believe it or not, your lung function, at the core of your ear function. It's been well known for many years that people with ear imbalance problems frequently have a sinus or allergy problem underneath. And what's an interesting thing that I found through practice, and now is actually coming out in the medical literature, is frequently sleep problems arise from disabled nasal breathing. I've had very good results with treating sleep apnea when I've treated the nasal obstruction, because that opens up the whole anatomy of breathing. And true, there might be other things that need to be done for sleep, such as attention to the throat, attention to the weight, and other things. But on a very simple level, the nose is an under-recognized component of the sleep cycle. Consequently, when I'm dealing with sleep and snoring, I'm always addressing the nose and sinus, and frequently will help the patient. Patients will frequently come to me regarding snoring, and there'll be a real problem with, bedroom compatibility, snoring, which is a social issue, but there'll also be problems with the person feeling tired all day and having legitimate sleep apnea. So how do we deal with this? Well, there's actually a whole spectrum of procedures we do to reconstruct the airway, but I want to focus on a simple procedure. There's a minimally invasive procedure called the palate pillar implant. And what this does to help snoring is, basically the palate flops around. It's almost like a big old floppy sail of a sailboat flopping in the breeze. There's actually these implants that are called palate pillars, and they're like the battens in a sailboat. They're inserted in the office. It takes a very minimal amount of time. There's no lost time from work. It's done under very comfortable conditions with topical and local anesthesia. And patients that snore, and more importantly their bed partners, can get a lot of relief from the snoring. And frequently mild degrees of sleep apnea can be cured by this procedure, sometimes in combination with very minimally invasive nasal procedures. I've found frequently that if I can tailor my therapy, whether it's allergy injection therapy or whether it's surgical therapy or both of the patient's concerns, we can get a very good outcome. And I've been doing a lot of sinus surgery, thousands of cases, and I've boiled it down to a pretty reliable surgery where most of the people, most of the time, get a good result. I try to keep it simple, I keep it safe, I use reliable techniques. For many years I have not used packing, and I try to make it a trouble-free recovery for the patient.